Just to start, we'll have you introduce yourself, your name, and kind of what you do.
My name is Kaitlynn Tennant, and I am a second year medical student at Rocky Vista University in the Southern Utah campus.
Awesome, thank you. Just to kind of start off, how has the experience of being a medical student while in a pandemic been for you? What's that been like?
It's it's been very different than I expected medical school to be. I mean, everybody knows when they come into medical school that it's going to be a rigorous time, that school is going to be very time consuming and stressful. But I've at this point been a medical student longer in the pandemic than I have been a normal medical student. So for my first semester, I was able to be on campus and use school resources, to be mixing with my peers and learning hands-on from professors. And that ended last March of my freshman year of medical school. And all the time since then, we've been almost entirely virtual. And so I haven't been able to have that same connection and that same support group from my peers or from my staff. As much as they try to reach out to us, it's been really hard to be connected to them. I've had a lot less in-person hands-on experiences. I've had no patient experiences, which is a little bit unusual for a second year at my school. So it's been really different. I'm learning to do everything from home. I was learning how to be a medical student at the same time I was learning how to be an American in a pandemic.
That is a good point. So would you say that you feel like your education is lacking in any regards because of the new way that you're learning?
I think it is a little bit. I think that, my school is done what every medical school I've heard of in the United States has done. They're doing the absolute best they can to keep everyone safe. But it's just been impossible. It's impossible for me to work with the veterans home that's associated with my school, for example, because the home for the safety of the residents has been completely locked down since the pandemic started. And that was the main relationship for me to have patient experiences during my first 2 years of medical school. And so, in a lot of ways, I think that next year I'll be going into my clinical rotations. I'll be working with doctors and patients full time. And I will be less prepared than students who went before me because I will have never worked with a patient before doing it in my third year. So, in that way, I think, my education has suffered, not necessarily in a way that could have been done differently given the pandemic. It's not anyone's fault, but it is different. And I think my entire class is going to go into their clinical rotations less prepared than the years before us.
Right, right. We had a interviewee previously who made a comment that the incoming medical students actually know more than they think. Like, they're technically prepared, but
Mm-hmm.
the confidence that comes from the application of what they're learning might be lacking. Do you see that maybe a little bit in yourself or in your peers?
I think definitely. I would hope that I know what I need to know, but it's scary going into a healthcare degree, any healthcare degree. You're taking somebody who is sick and vulnerable, and it is going to be your responsibility to help change that, to help them feel better, to help them achieve goals at a very vulnerable time in their life. And that's something that even if I've read everything that I should do, it's something that I don't feel like I have a ton of confidence to do right now because this is such a serious career in that way. So I hope that I regain all of my confidence and realize that I know enough when I get to third year. But yeah, I think I would feel a lot more comfortable had we been able to have more of the normal experiences.
Well, I know you, and I know some of your peers, and you guys are very, very intelligent, very compassionate people, and I think you guys are going to catch up and be more prepared than you think. And I know a lot of the doctors that you're going to be working with in the future have faith in you, and they're excited to work with you. So, um, how about healthcare? I know you're not in it yet, and you're just preparing to go into that, but how do you think this is going to impact the future of healthcare?
One of the things that I think we've seen expand a lot this year is telemedicine. That was something, and I got to watch it from a medical student's perspective. You know, when I first entered medical school, there was just a little bit of talk about telemedicine. It was sort of like, you know, a sub note on some slides, like, yeah, telemedicine exists and you might do it someday, maybe, but, and yeah, maybe like a select group of people are trying to perfect it. But it's not something we were going to really focus on in medical school. All our focus, my first semester, every practice patient encounter we did was in person. And since March, every practice patient encounter we have had has been over telemedicine, for the restrictions, but it's just utterly exploded. And now they're talking about how we will be, you know, completely expected to be competent in telemedicine going into this career. And I think that's something that's not going to change back. I know as a patient with my own healthcare provider, I have had multiple telehealth appointments now, and I've enjoyed the convenience of them. I practice exclusively telemedicine appointments as a practicing, preparing to be a physician. And I think that that's something that a lot of patients aren't going to want to go back to in person. I think a lot of physicians, now that they're getting more and more familiar with the technology out of necessity, I think a lot more things could be shunted towards telehealth. And I don't think that's altogether bad. This was just sort of the catalyst that might have been needed to really expand that industry.
I in the past I've heard conversation about how telehealth is really good for chronic care, where like you need frequent appointments, but they don't need to be long. They just need to be check-ins. And then
Mm-hmm.
also for things like bringing in multiple providers on one topic. It's like getting the
Mm-hmm.
specialists and things like that when it's just for a consulting. And I'm really excited to see how that goes in the future. Let's see. I guess let's change gears a little bit. So it's been over a year now since we've actually identified COVID-19 and almost a year since it's been declared a pandemic. How have things changed since the very beginning where we were all in lockdown to now where there's hope with a vaccine? How have you seen things change?
What kinds of things?
So kind of just the outlook that maybe people have on their health and on the pandemic.
I know I've seen a really interesting curve over people's outlook on the pandemic. So in the very beginning, way back when we first started hearing about this, I first started hearing about this in February of last year. And that was before anything had really shut down. And I remember talking about the pandemic with my fellow medical students at the school, and it was a joke, and we laughed about it because it just, you know, we looked at the very, very early numbers of it just briefly, and we're like, this is just being blown out of proportion. That was what we heard and said the most often amongst each other. This was blown out of proportion. Everybody was going to forget about it within a couple of months. I had a case of bronchitis. My whole school had a cold and mine progressed to bronchitis. And I went to a local physician at the time and he started joking with me. He's like, so do you think you have COVID? And I'm like, no, I don't think so. And this physician was joking too. He's like, we're going to see COVID. We're all going to forget about it in a couple of months. He's like, I didn't receive a COVID test at that time. And it was just something that in the healthcare profession, I think we were very confident that we could handle anything that came our way. We were very confident that this would be no more complicated than a regular seasonal flu. And we didn't take it seriously. I remember being shocked. I was on my spring break when my school shut down, and that was the same time that my church shut down for safety. And I remember I was with a friend who's in my year of medical school at the time when we were getting these emails about everything shut down. And we were like, what were we missing? We were utterly taken by surprise when this pandemic became much more serious in March. And then when we started just really looking at the projected death tolls. And I think, you know, since then we went into complete lockdown. Of course, there were all the precautions, and so that was a complete reversal. And now what we're seeing is still a lot of caution. I think sometimes we even see a little bit of impatience as people are eager to be vaccinated, especially among the medical students. I think there is a pretty wide consensus that we want to be vaccinated. We're eager to get back to being in person, to push the limits a little bit. But I also, like, all of us wear masks everywhere we go. Our school is remaining very cautious to make sure that everyone stays safe, even when people are starting to be at the bit to get better, I think, a little bit. But I think that we are hearing a lot more hope. Last year I run some student organizations within my medical school, and last year we were told as student organization leaders to not expect any in-person meetings ever, really, until for like at least a whole nother year. And it was just up in the air, just don't plan anything. And now it's starting to say, well, maybe within a couple of months we can. There's like this cautious hope. We don't almost want to get our hopes up too high and suddenly start expecting everything, but I think it's nice to have this cautious hope. I'm keep waiting and checking for the right times when I'll be offered the vaccine, and I think that's something that we're really eager to do, because we want to be in person again, and we want to be able to catch up on things we've missed.
Has the school told you anything about when the students might potentially be getting the vaccine? Because I know medical providers are in the first wave, but you guys aren't quite medical providers yet. So do they have a plan for what they're wanting to do with you guys?
Yes, and for my medical school, it's a little different because we have two campuses split across two states. And because different healthcare systems are invoking different plans, then the times that people will be vaccinated in Colorado are different than the times that are going to be vaccinated in Utah. I'm most familiar with Utah's plan. I know that in Utah, Intermountain Healthcare System has decided to count third and fourth year medical students that are rotating as their employees and professionals in this way. And so over half of our third and fourth year medical students are now vaccinated, and that number is going up every day. First and second years in Utah have not been able to be vaccinated yet. However, I have heard that Rocky Vista University in the Utah campus is potentially going to receive permission to house vaccines in our campus because we have the ability to store them, and that we would be able to then be a hub to start vaccinating the elderly in this community. And as part of that, we would be able to be vaccinated ourselves as first and second years to assist in that effort.
That is
So there's a
incredible.
lot that we can be vaccinated within the next month.
Well, good luck. I hope it works works out. That is cool, and that's a great way to be connecting with your community again and getting those hands-on experiences. That's really cool. Um, as a cohort of your second year, do you feel like going through this experience is bringing you closer together, or kind of preventing you from building bonds because there's less face to face?
I really think in a lot of ways it's prevented us from building a lot of bonds, and that really saddens me. I see it even worse in the cohort behind me that to date has never really had in-person time. And I know very few of them. Usually there's a strong connection in our school between the years. First years very close to second years, and it hasn't happened this year. Very few second years know very many first years. I know of like two. And from what I hear from the first years I know, they don't really have strong connections with each other at all. They don't really know each other. They haven't really spent time together. I know for my class, I felt very close to my class on my campus. Our class is only about 100 some, so we're pretty small. And my first year, I felt very close to them. I, knew everyone's name and could talk to just about any of them. And then I had some really close friendships that are kind of built from lots of late night studyings and things like this. And I haven't seen most of them since spring break of last year. And so we're on Zoom calls together, but we're on Zoom calls then with both campuses. So we're hitting 250 some students plus any professors. Most everybody has their mics off. It's like sitting in an auditorium where you can't even talk to the people on either side of you, and you can't talk to people when you're going in and out the door. So really, I think that I haven't gotten to know the Colorado campus very well at all. I haven't gotten to work on those bonds that were kind of just starting with my class. I think that I don't know what's going on in a lot of their lives. Someone mentioned to me that a member of our class had switched schools at like the start of this year, and I didn't notice for like 5 months.
Wow.
Because just don't see each other. And I was shocked that this person wasn't still at our campus with us. And so I think that there's, I think everybody, and I think I've seen this, even in the nation, I think when people are under a great deal of stress, especially a stress that kind of spans the region or nation like a pandemic can, people tend to turn closer to their families, closer to their close friends, and then they kind of turn inwards to their bubbles. And I think I saw that here too. So people became very close with their roommates. People became very close with like one or two people, but you had to limit your social bubble. And so I think that I'm very close to like two or three of my classmates. And everybody else who I was friends with, am friends with, I think that I don't see them. And I know that next year we'll all be in different parts of the region. This was kind of our bonding time. I'm a little bit robbed of that, but so is everybody.
Is the school or is any individual doing anything to um, any like online activities or something to make connections, or is that not really happening?
There have been multiple different attempts to try to do things like that. I think it's hard to get a lot of participation in a lot of the online activities. Some of the more successful ones were almost like desynchronous kind of activities. So like it used to be after every exam, they literally had to mark out a quiet zone outside of the exam because students would gather. And so we would gather just outside the quiet zone to talk about exam. And we have exams, you know, almost every week to every other week. And so we were all together as a whole class talking about every test and things like that. And one of the things that they started to try to recreate that was sort of like a posting scavenger hunt that they had on our class teams page. So we have a class teams page that we can post things on and see things that way. They've tried like some things like that where we can at least see like pictures of where everybody's at or thoughts that they have or things like that. But it you know, it doesn't really get the same participation. It's not sort of the nice easy of like, you know, walk in, talk to the people around you, walk out. And so I think there have been some efforts and I appreciate them a lot, but it's impossible to recreate the same experience.
Interesting. So, how have
Mm-hmm.
you been doing during this pandemic?
Um, I think the pandemic has definitely affected my stress levels. I think it's affected a lot of people's stress levels. And so, you know, medical school is a really challenging time to be going through, especially in my school. The first 2 years are purely didactic, which are the harder years in a lot of ways because it is just preparing for test after test after test after test. And so I was already before the pandemic pretty stressed, always struggling to find that balance of sleep and exercise and food while keeping up on all of my classes. And it was a hard adjustment for me to change my whole study schedule, to change my study space multiple times as different areas closed down. And so I think now we've been in this for almost a year and I've hit a stride, but there were a lot of months of struggle, especially because everything kept changing. It wasn't even one change to where we are now, but it was everything's going to shut down. Now everything's going to light up. Now everyone shouldn't wear masks. Now everyone must wear masks. Now I can use study rooms at the school. Now I can't use study rooms at the school. Now I can use study rooms at the school, but not with other people. And so, and it's just be going through multiple changes of how my study schedule will work is something that was definitely challenging for me. And so now that I guess that's one of the things I hope for as things start to lighten up, that I'm finally in like a stable situation that I can ride out through the end of the year, hopefully. And that helps me a lot. It was just hard to have so much change during this time where I'm trying to pass medical school and also trying to balance the fact that the world is changing around me every other day.
Right, right. That is a good point. So, what do you do to cope with all of that stress? And like, have your coping strategies changed between just being the stress of being a medical student and then the stress of the added pandemic on top of that? Has that altered it, maybe?
Yeah, I think so. One of the ways that I cope with stress is exercise. And that was something I noticed that, you know, exercising in the mornings was something that had already become something that was helping me every day during medical school. But I noticed like since the pandemic, it sort of almost became a necessity. It became just a regular, stable part of my day. And so I think that's one of the biggest ways I do it is by trying to go for a run every morning. Um, I, and besides that, you know, as hard as it is, I think what's been a huge boon to me is being able to connect to just one or two classmates and just have somebody who I can lean on, who I can have within that bubble to where we can be around each other in person and take the same precautions. And I think that that has been hugely important for my stress. I think before the pandemic, I had a wide group of friends and I would bounce between people, and it was never essential for me to see the same people over and over again. But I think since the pandemic, it's been essential for me to have some in-person contact. I realized how important that was for me to have somebody I could see in person.
This pandemic has been a really good opportunity, I think, to teach a lot of resiliency and show how much there already is within the community and within individuals. But would you say that as far as learning resiliency, has this maybe prepared you for future goals that you have in the medical field?
Um, Yeah, I'd like to think I'm more resilient after getting through this. I've had one or two professors mention to us in small groups that they feel that they would not have been prepared to deal with the pandemic during their didactic years of medical school, that they're really proud of us for the way that we are continuing our schoolwork and everything else with just everything that's been going on in the world. And that's really encouraging to hear from, these practicing physicians and teachers who I respect so much, that they recognize that we're really building a lot of strength in what we're doing right now. And medicine is going to be a hard career. It's not the kind of career that is going to be something I can punch in, punch out, and be half asleep through my day. I need to be on my game pretty much every day as a physician. And I think I need to be on my game no matter what's going on in the world as a physician. And so that is something this has taught me. I am, in some ways, even though medical school has been hard during the pandemic, even though I think that there are aspects of my education that are just less than they could be during the pandemic, just because of the precautions we've had to have. I think I'm still proud that my education continued almost uninterrupted. The school closed down, but not a single test date changed. Not a single lecture was taken off the charts. The only things that we lost were our in-person and clinical experiences. And in some ways, I'm proud of that, because it did teach that whatever goes on in the world, the practice of medicine has to go on and will. And I think that's a pretty good mindset for me to carry into this field. I think that whatever is going on in my life or in the world, as a physician, this has to go on.
Wow. That is really inspiring to think about it that way. That's really cool. So, okay, what is the greatest lesson that you've learned through this experience as either an individual or as a student?
I think, and it's funny, I think in some ways you don't miss things until they're gone. And I think the greatest lesson I've learned is the importance and just the value of in-person networking connections. I'm not the kind of person who really likes to do like networking activities. I don't feel particularly comfortable on those scenes where people are just gathering to officially network at an event. But I've just realized just how important it was, those networks I was building with my classmates who are going to be my peers in this career. I realized how much it can change my ability to focus and study by having one or two people in person with me, working with me. And I think that that's something that's really valuable. I might have been someone who said, yeah, I could do loads of time by myself. I could be shut up in my own little office all the time and I'd be totally fine. And I think that's false. I think that it's a value that potentially even wider than just me. I think that's something I'm even seeing people, throughout the country just saying how much they wish they could be back together. They wish they'd taken more time together when that was available to them. They can't wait to spend time out with people. And I think that's great, because in some ways our culture over the last years has been kind of trending in my sight to be more disconnected from each other. And it would be interesting to see if this pandemic is something that teaches us to be more connected to each other on a personal basis. I think that's something that I definitely value more than I did.
Right. No, I agree. We spent so much time staring down at our phones that when that was all we had, we finally learned what it means to give it up and how how precious that is.
Yeah, yeah.
Well, is there anything that we haven't talked about that you think is important to mention about these events?
Um, I don't know. I think we've really covered a lot of it. And like we've said, it'll be interesting to see my year and the year behind me. That I think for medical students, we're the most affected during our education going into this. Will be interesting to see if there are differences in the way that we're viewed during our clinical years, in the ways that we're viewed going into residency with less experiences. But I think in the end, we're all going to be just as qualified physicians as everybody else once we finish our training. This will be something that we'll see the ripples of in our 2 years of medicine through the rest of our education. Um, so it'll be really interesting. But I think that in the end, it'll work out.
Awesome. So I do have one more question. Just
Sure.
how do you think this event should be remembered in history? So in 20 years, when we're telling our kids about this.
Hmm. I think that I think that this is important that it is not just forgotten, which would be easy to do, once we're fully vaccinated and, 3, 4 years away from this, be like, oh, yeah, whatever that happened. Because I think there are lessons that are being learned here. I think it's important for us to remember how many things could have been done online so much easier and to carry these things forward with us. I think it's important to look back and say, look, that's a time that the country went through something hard and got through it. And I think it's important to have those stories, to be able to learn from them. It's like, yeah, we learned some hard lessons and we're going to keep building on what we learned. We learned that we can get through hard times and it's still fine.
That was a good way to end. Thank you so much.
Yeah, no problem.
It's been a pleasure to talk to you.